Hello, I'm here to see Dr. Popovich, please.
Hi, good morning. Can I get your first name, please?
Emma.
Emma, hi Emma. I'll go ahead and get you checked in. If you'd like, go ahead and have a seat.
Perfect.
It'll just be a few minutes.
All right, thank you.
You're welcome.
Hey guys, and welcome back to our Your Health Matters series. Today we are finally getting to go to my appointment with Dr. Popovich. We're doing more kind of a meet and greet situation to get to kind of know more about him and what the providers strive to accomplish here at SRMC. We are going to get the full inside scoop, and let's go.
Emma.
Hello.
Good afternoon. We'll go to the right.
Alrighty.
I'd like to get your weight and height at the scale before we go to your exam room.
Okay, which one would you like first?
Let's do your height first.
Okay.
Okay. And your weight. All done. Follow me this way. This is Dr. Popovich's office.
All right, thank you.
You're welcome.
And does it matter where I sit?
Anywhere you're comfortable.
All right, let's just go here.
Today it says that you're here to establish care for a meet and greet with Dr. Popovich. Is that right?
Yes.
Okay. So I'd like to ask a few questions, make sure that your health chart is ready for him, and then I'll get your vitals.
Okay, perfect.
All right. Do you have any allergies, Emma?
I do not.
And how about current medication?
I am not on anything at the moment.
Okay. Any past medical history, such as diagnoses or surgeries, procedures?
Nope.
Any family health that you know of?
I'm not sure.
Okay. Mainly like diabetes, cancer, strokes, heart attacks?
Nope.
Awesome. And then, how about any alcohol or drug intake?
No.
I will get your blood pressure now.
Alrighty.
So this is going to go on your upper arm, and then I'll use your opposite index finger for your oxygen.
Okay. Mind if I set this down?
Absolutely. Okay, that one is ready. And index finger. Perfect. And then I'll have you uncross your legs so that we have a good blood pressure. That'll just take a moment.
A few moments later.
Okay, oxygen, heart rate looks fine. I'll take this one. All right. The doctor will be in to see you in a moment.
Alright, sounds good. Thank you.
No problem.
Everyone's super nice. Definitely seems to put your care at the forefront, prime priority, and I definitely feel in good hands. And there's usually a wait in between because the nurses communicate with the providers about what's going on, why you're in to see them today, and kind of what they know what they're going to be coming into.
Hello.
Hello.
How are you?
Good, how are you?
Good. I'm Dr. Popovich.
Nice to meet you.
Nice to meet
I'm
you.
Emma.
Emma, nice to meet you.
I'm here to get kind of more an inside look at to what the appointments look like with the provider, trying to get to know my provider a little bit more kind of situation. Would you mind if I just set this down so
Nope,
we can
that's
just talk?
absolutely fine.
Okay, perfect.
And since we are in the room and you're not having any symptoms, I'm okay with you taking that mask off.
Okay.
If you would like to. You
Sounds
can
good.
keep it on
Yes,
if you
thank you.
want.
I will definitely do that just to make it a little bit
Mhm.
easier to hear and everything. So I am only 21, as we've kind of established, and healthcare is kind of intimidating to more of the younger generation, especially of the young adults and teens becoming adults. And so I'm trying to make it less intimidating and share the importance of healthcare.
Sure.
And you are our next step is
Sure.
in the provider realm. So why do you ask the kind of questions you normally do when you come into an appointment with a patient?
Sure. And you know, and I can answer that question for you, and it's actually a pretty easy answer for me. I think something that I want to mention though is I think the idea of kind of younger adults coming in and being maybe a little nervous to come and see the doctor or, the provider in general is, when you're growing up and you come to the doctor, it's usually associated with being sick, right? And then even when you're not sick and you come to the doctor as a kid, you end up getting shots and you end up feeling pain when you come here.
Exactly.
I think it's important to note that that's not necessarily what happens, when someone your age and you're kind of coming into the doctor for a checkup. Now, it's important because there's things that we need to start screening for. There's things that we can prevent, especially with a primary care doc. That's the main thing that we do. That's our goal, is to prevent things from happening. And it's one of the big reasons that insurance companies put so much emphasis on you going to see your primary doc, every year, because if you can catch things early, excuse me, especially big things, it's going to definitely be more healthy for you. It's also going to save your insurance company a lot of money, which is why they tend to want you to do that.
Right.
Basically, the way this goes is you come in and then I just try to get to know you as much as I possibly can, right? Like what your past medical history is, any surgeries you might have had, any medications that you're on, any history of, big things in your family, heart attacks, cancers, blood pressure, diabetes, these types of things. And then it kind of helps me to know what to watch for down the road.
Okay.
So, and the idea of kind of coming in and meeting me and talking to me, me asking the questions that I do, again, is just so I know kind of which route to go as far as what testing you may need,
Right.
So, for instance, if you come in here and you have some kind of problem, I want to come in here and get as much information that I can. And then basically what I'm trying to do is rule out as much stuff as I can, right?
Okay.
So that way when we leave here, and I'm still left with a couple questions as to what this could be, or if it's, nothing and it's, some kind of viral infection that we don't need to do anything about, it kind of gives me the right direction as far as what labs to order, what x-rays you might need.
Okay.
Instead of, you just calling me and saying, hey, I have a cough, so then I'm just ordering a bunch of x-rays and labs, and, I could do that over the phone.
Right.
You come in here so I know what I don't have to do.
Definitely.
Right? So, or, and a lot of things you can diagnose in the room as well. You don't have to do any of that stuff.
Okay. And so you guys don't do just when you're sick. I believe many of you here at SRMC are able to do you do labor and delivery and so many other things. What would those include?
So, yep, you're right. So for primary care, true primary care physicians, which is, here is myself, Dr. Scholler, Dr. Allard. We take care of children, from newborn all the way up until the time of death.
Okay.
We take care of OBGYN patients, so mainly with pregnancies. I myself do self-injectomies or tubal ligations. Also, some female surgeries, not a whole lot, DNCs in particular if necessary. We do birth control stuff. We'll do IUD placement, Nexplanon placement, that type of thing as well.
Okay.
So from in the womb to, all the way to the end of life.
Okay, so in all, you really could go to your provider for almost nearly everything, then, correct?
Yep, absolutely. And one of the big things about us is, we're not necessarily specializing in anything, right? Like we do OB, we deliver babies, and we do some, minor surgeries, like I said. But we are very good about realizing when something needs to go to a specialist.
Okay.
Right? So that's something to kind of keep in mind as well. You can come into us for anything. But if we feel like something needs a higher level of care, or maybe something's kind of out of our comfort zone, we have no issue sending it to somewhere else where, you're going to get the best care, because that's what it's all about. It's more a matter of judgment for the doc, and then also comfortability of the patient. The patient is number one when it comes to your care, and you're going to get to make those choices.
Definitely. And so that's where I would say it comes into definitely getting to know your provider and building that relationship is super important, because then you build those relationships and that trust in your provider, and then you would that advice you provide, I'm going to want to.
Absolutely, and you made a great point. It's very important to have a good relationship with your provider, and you should be able to ask them questions that are maybe a little uncomfortable, because again, it goes back to that idea to where I have to come in here and ask you certain questions. Some of the questions may not be comfortable for you to answer. It may be questions you've never ever had to answer for anybody in your whole life. But if I'm asking you that question, it's helping me to, again, rule things in and out, right? To know what testing I may need to get, and to let you know, essentially, good advice, what I think we should do about it. Right? And,
Okay.
And if you don't have a good relationship with your provider, and you're holding things back, then you're not going to get the care that essentially you deserve.
Okay. And my last question would be, when it comes to like prescribing medications and stuff like that, how do you know what exactly route to go and when not to prescribe something?
So that's kind of a tough question. You know, it always, of course, it depends on the patient and kind of what's going on. Sometimes it depends. Well, a lot of times it'll depend on what other medications you might be on, what other medications you might be on that could, interact with a certain med. I'll tell you, one of the biggest questions that I get when it comes to not prescribing medications is, when it comes to illness, antibiotics in particular, right?
Okay.
And I think a big thing to note with antibiotics is antibiotics kill bacteria. That's it. There are some antivirals that'll kill viruses. There's antibiotics that kill bacteria. There's antifungals that'll kill a fungus, right? These are three completely different organisms. Sorry. In some cases, these different organisms can kind of make you feel in a similar way depending on where they're infecting. But again, it's just a matter of what the organism is. And again, based on the testing that we may or may not do, x-rays, strep testing, looking in your ear, like these are types of things that we do. Check your urine, right? To check and see if there's an actual bacteria that we're targeting to kill.
Okay.
Right? Because if that's not there, then there's no point in me giving you an antibiotic.
Right.
All that's going to do is give you all the side effects, diarrhea, chance of bacterial overgrowth of other organisms. We breed these super bacteria when we're just giving everybody these antibiotics, and then you get antibiotics that are resistant to certain bacteria, right? Or to certain antibiotics. Bacteria that are resistant to certain antibiotics. So, with that, we try to limit the antibiotic prescribing for actual targeted organisms, and when we can assure that you actually have a bacterial infection, that you would benefit from the antibiotic.
Okay, that makes sense. And then, would you have anything specific left that may have untouched to suggest to people like me when they are entering the healthcare system as a patient?
I think, again, like I mentioned, one of the big things is the importance of coming in early. Come in, get checked out. For instance, a 21-year-old female, that's when you should start getting pap smears. It could be a very uncomfortable thing, but if we can find, early cervical cancer, early cervical dysplasia, that type of thing at 21, it's going to be way easier to cure, to fix completely, than if you're waiting 10 years and that, that cancer's had 10 years to kind of spread, and, it's hard to tell where it would be at that point, right? And now we're talking possible, hysterectomies, big cone biopsies, that type of thing, which could, at that point, limit your ability to have children. So, again, I think that's a great example where if you come in at 21 and we know that it's there and we monitor it and we can even fix it early, it's going to be a whole lot better for you overall to know that it's there, to get it fixed, to get it taken care of, rather than waiting 10 years because, now you're 30 and you're older and you're ready to take responsibility for your health care.
Yeah, for sure. So if you are thinking about going in just to see if something's wrong, even though you think something might not be wrong, come in because you never know.
That's right.
Well, thank you so much, Dr. Popovich. I appreciate getting to meet you.
Great to meet you.
Definitely look forward to hopefully getting to see you again soon if I'm feeling a little unwell.
Absolutely.
For more information, visit sydneyrmc.com/yourhealthmatters or call us at 308-254-5825.